Renal and pulmonary regulation of acid-base balance, clinical implications and management. Acid-base disorders effect is almost equal to 15% of hospitalized patients and are linked to a twofold increase in mortality. The kidneys and lungs cooperate through bicarbonate reabsorption, hydrogen ion excretion, and ventilatory adjustments to maintain pH 7.40 plus or minus 0.02. Accurate diagnosis relies on arterial blood gas analysis, anion gap calculation, and assessment of compensatory mechanisms. Prompt correction with sodium bicarbonate, acetazolamide, or ventilatory support, guided by KDIGO and surviving sepsis campaign recommendations, improves outcomes. Key points. Note: normal arterial pH ranges from 7.35 to 7.45. Values less than 7.35 define acidemia, AHA/ACC 2023. The renal bicarbonate reabsorption capacity is almost equal to 80 mol/day, is almost equal to 2% of filtered load. Acute metabolic acidosis is diagnosed when HCO3 less than 22 millimoles per liter and PCO2 greater than 45 millimeters of mercury, Winter's formula. Sodium bicarbonate bolus of 1 milliequivalent/kg, max 150 milliequivalent, over 30-minute raises serum pH by 0.10.2 units, NEJM 2022. Acetazolamide 250 mg 4/PO every 8 hours reduces HCO3 by 35 moles/L within 2 hours, JAMA 2021. In chronic respiratory acidosis, renal compensation adds is almost equal to 1 millimole per liter HCO3 for each 10 millimeters of mercury rise in PCO2, ATS 2021. The anion gap, AG, greater than 12 milliequivalent/L identifies high anion gap acidosis with a sensitivity of 88%, Kidney INT 2020. Rapid correction of chronic metabolic alkalosis, greater than 12 milliequivalent/L, greater than 0.5 milliequivalent/L/H carries a 5% risk of cerebral edema, NEJM 2023. KDIGO 2024 recommends bicarbonate-targeted therapy for CKD patients with serum bicarbonate less than 22 millimoles per liter to slow eGFR decline by 30% over 2 years. Mechanical ventilation set to tidal volume 6 milliliters per kilogram predicted body weight reduces ventilator-induced alkalosis and improves 28-day mortality by 12%, ARDSNet 2022. Overview and epidemiology. Acid-base regulation refers to the integrated renal and pulmonary mechanisms that maintain plasma pH within a narrow physiologic range, 7.35–7.45. The International Classification of Diseases, 10th revision, ICD-10, codes for primary acid-base disorders include E87.2, acid-base imbalance, unspecified, E87.1, hypochloremic metabolic acidosis, and E87.3, alkalosis. Globally, acid-base disturbances are documented in 1520% of all inpatient admissions, with the highest prevalence in intensive care units, ICUs, where up to 45% of patients develop a primary or mixed disorder, Lancet RISPER Med 2021. In the United States, the National Inpatient Sample, 2022, identified 2.1 million hospitalizations with a principal diagnosis of metabolic acidosis, representing a 3.5% increase from 2015. Age distribution shows a bimodal pattern. 12% of cases occur in patients less than 30 years, often due to diabetic ketoacidosis, and 68% in patients greater than or equal to 65 years, often due to renal insufficiency. Male sex carries a relative risk, RR, of 1.12 compared with females, while African American ethnicity is associated with an RR of 1.27 for chronic metabolic acidosis, largely driven by higher rates of hypertension-related CKD. Pathophysiology. Acid-base homeostasis is orchestrated by 3 primary buffers: the bicarbonate buffer system, the phosphate buffer system, and the protein, hemoglobin, buffer system. The bicarbonate system dominates plasma buffering, accounting for is almost equal to 70% of total buffering capacity, J. Physial 2021. The nephron reabsorbs is almost equal to 80% of filtered bicarbonate in the proximal tubule via the Na/H exchanger 3, NHE3, and Na/HCO3 cotransporter, NBSU1A. Genetic loss of function mutations in SLC4A4, NBSU1, reduce proximal bicarbonate reabsorption by is almost equal to 30%, leading to a chronic metabolic acidosis with a mean serum HCO3 of 15 millimoles per liter. Kidney in 2020. Clinical presentation. Acid-base disorders manifest with a spectrum of symptoms that reflect the underlying pH shift and compensatory mechanisms. In a multicenter cohort of 12,450 hospitalized patients with metabolic acidosis, the most common presenting complaints were dyspnea, 68%, nausea/vomiting, 55%, and fatigue, 48%. JAMA Intern Med 2022. Atypical presentations are notable in the elderly and diabetics. In patients greater than or equal to 75 years with DKA, 30% present without classic polyuria, instead showing confusion, 41%, and hypotension, 27%. Diabetes Care 2021. Immunocompromised hosts, e.g., post-transplant, may develop silent metabolic alkalosis due to tacrolimus-induced distal tubular H secretion, with 12% lacking overt respiratory signs. Transplantation 2022. Key points: respiratory compensation, hyperventilation, occurs in 85% of acute metabolic acidosis cases, producing a Kussmaul respirations pattern with a sensitivity of 92% for detecting pH less than 7.30. Chest 2021. Altered mental status is present in 22% of severe acidosis, pH less than 7.20, and predicts ICU admission with an odds ratio, or, of 3.4, Critical Care Med 2023. Kussmaul respirations have a specificity of 94% for metabolic acidosis, and Intern Med 2020. Hyperventilation with a respiratory rate greater than 30 per minute predicts a PCO2 less than 30 mm of mercury with a positive predictive value, ppv, of 88%. Diagnosis. A systematic approach integrates arterial blood gas, ABG, analysis, serum electrolytes, and clinical context. 1. Arterial blood gas, pH, reference 7.35-7.45, PCO2, 3545 mmHg, HCO3, 2226 moles/L. Key points: sensitivity for detecting metabolic acidosis, 96%, ABG versus venous sample. Normal AG, 812 milliequivalent/L, AG greater than 12 milliequivalent/L identifies high anion gap acidosis with 88% sensitivity. Elevated lactate, greater than 4 millimoles per liter, has a specificity of 92% for septic shock. Winter's formula for expected PCO2 in metabolic acidosis, PCO2 equals 1.5 times HCO3, plus 8 plus or minus 2. References. 1. Berg P. et al. Alkalosis-induced hypoventilation in cystic fibrosis, the importance of efficient renal adaptation. Proceedings of the National Academy of Sciences of the United States of America. 2022, 119-8. PMID, 351730044, https://pubmed.ncbi.nlm.nih.gov/351730044. DOI 10.1073/NOS.21168361119. Thank you for watching. For the full article visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.